DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, welcome to DocTalk. Look who's here. We got Dr. Apley. It's going to be a great show. We're going to talk about anaplasmosis, from infection to signs to treatment. Please stay tuned. We'll be right back after these messages.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson, and I'm here with my friend and colleague, Dr. Mike Apley. And Dr. Apley is the Frick Professor of Clinical Sciences. He's a boarded pharmacologist. He is at the Veterinary College at Kansas State University. And if you haven't seen or heard of Dr. Apley and you've been in the beef industry, I don't believe you've been in the beef industry, because this is probably one of the world-renowned veterinarians associated with beef cattle. And specifically with the bugs and drugs and everything, with trying to get them well. So appreciate you.
Thanks.
So let's talk about anaplasmosis, and let's start out by what it is and the infections.
So it's a bacterial disease, but it's an obligate parasite of red cells. And so many of your people watching this will be familiar with anaplasmosis, unfortunately, depending on where they are. So in Kansas, where we're sitting right now, a survey done at the diagnostic lab showed that about 52% of the herds had at least one positive animal, but very heavily towards the eastern part of the state. Like where we are right now, Riley County, Pot County, that area, about 82% of the herds had some type of infection in there, at least one cow. And I imagine everyone's familiar with the signs of that cow, that she loses condition, she gets a little belligerent as she runs short on oxygen because her liver's snapping up her red cells to try to get rid of the infection. And a young calf, like if a 4-month-old calf is exposed, they may just look like they have pneumonia or something, or they're just dumpy, they feel bad, they run a fever, they may breathe a little hard. And a lot of them, you go, oh, that was pneumonia, they may get treated, but that wasn't what the disease was, and they'll snap back because their bone marrow can produce the red cells fast enough to outrun the clearing of them and come back up. 8-year-old cow can't do that.
Right.
And that's what everyone's familiar with, is that cow, yellow eyes from jaundice. When you first see her before the jaundice, the yellowing from the breakdown of the red cells, she may just be incredibly, incredibly pale. And one of the places you check, of course, is the vulva, and it'll just be white. And then down they go, and once they're down that low, it's hard to bring back.
Kind of walk through the kind of the timetable of, is it something that's in the environment? Is it something that's, how's it being transmitted?
The main transmission method is the tick.
Okay.
And the tick that transmits it is able to allow the Anaplasma marginale organism to replicate in their salivary glands. So it's
in the tick.
In the tick.
Okay.
So it's actually able to grow in there so that it can last a long time in that tick. It takes a blood meal, falls off, takes a blood meal from another animal, and as it injects saliva, it's injecting that organism that's grown in it. But like a horse fly or a stable fly, if they carry it, it's just they have to take a blood meal off one animal and immediately go over, have some of that blood left on them, and inject that when they take a blood meal off another one.
Kind of like if we did a needle from
right.
one cow to another.
And we can spread it with needles. But like a horn fly, they're not really a spread of it because they tend to just stay in the same animal. So different flies, different contributions, but it mainly persists in carrier animals and in the ticks.
Okay. Well, let's take a break. When we come back, we'll walk through some of the clinical signs, some of the treatment, the prevention. You're watching DocTalk. We got Dr. Apley. Thanks for joining us. We'll be right back.
This Cattle Intel is brought to you by Neogen.
When giving injections to cattle, selection of the proper needle is important. In doing so, you must consider the route of administration and the size of the animal. The route of administration will determine the length of the needle. The routes of administration will either be subcutaneous, intermuscular, or intravenous. You will determine that route of administration by properly reading the label of the product. A shorter needle will be used for subcutaneous injections, and a longer needle will be utilized for intermuscular and intravenous injections. When selecting the proper size of the needle based on diameter or gauge, smaller diameter needles will be utilized for smaller animals and larger diameter needles for larger animals, but understanding that a larger number in gauge equates to a smaller diameter needle.
Thanks for watching Cattle Intel by Neogen.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Igenity Feeder. Igenity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Igenity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Igenity Feeder.
This fall, Rodrigo with Therapies came to me and wanted me to try this product. Since then, our medicine bills went to nothing. This is not an antibiotic. It makes your cattle keep hydrated. It makes your antibiotics and your drugs work like they should. We went from doctoring 40% of them last November to almost nothing. This is not a paid advertisement. This is good stuff. If you want to make some money, buy you some little calves, use this Therapies and save a lot. It is the best product I've ever used.
They're here. They're hungry. And they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cuperia, Nematodirus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Mike Apley. We're in Manhattan, Kansas, where Dr. Apley is the Frick Professor of Clinical Sciences. He is a boarded pharmacologist and just a wealth of information on all topics bovine veterinary medicine. And we're talking about anaplasmosis today. And so when we're talking offset, the clinical signs there's some pretty unique pathology and physiology, clinical pathology that's going on that kind of leads the animals to what we see. And I think it'd be great to kind of explain some of that.
Well, it's a parasite of the red cells. And just like our bodies, the cow's body goes, that isn't right, and we're going to get rid of it. So the way they do that is the liver pulls those cells out of circulation, breaks them down, ends up killing the organism, but also takes out the red cell. And when you get to what's called a parasitemia that's high enough, a very, very large percentage of the red cells are infected, so the liver's going to take them out. And that's one of our challenges with treatment is once it gets down to, sub 10%, they're really going to run short on air. So the way we could understand how those cows feel is let's take you up to the top of a 14er in Colorado and have you run laps. You don't have the carrying capacity to move that oxygen. So that's why they're so aggressive. They're fighting for air. And that's why that cow that used to be able to walk right up to is now trying to take you. But the challenge with treatment is we can kill the organism, but the body still recognizes that organism as foreign. So it's still going to take out the red cells.
Okay.
So when you look at their packed cell volume, you may treat them when it's at like 12 or 14% of their blood is represented by red cells, when normally to be up 40+%. But the liver's going to keep clearing them, so it still keeps going down for a couple days even after you treat it, before they have a chance to rebound. And that's why when you catch a cow that's very advanced in the disease, we can save some of them with treatment, but it's pretty tough because.
So kind of talk about then, because your normal's up here in the 40s and you're talking about getting down here to 10, you know, are they gonna just have a continued decline in increase in aggressiveness? Is that pack cell?
Usually when they get down there around that 10% range or so, and especially below it, they're really struggling to move oxygen in the bloodstream, which is what the red cell does with the hemoglobin. And so then they're going to be what we call anoxic, without oxygen to the brain, and they're going to take on that behavior. So when you see the dumpy ones, and she may show some jaundice in the eyes, some yellow from the red cells breaking down, and be a little dumpy, you know, she's down in the teens. And then when she gets real belligerent and aggressive, she's way down there.
And then, you know, one of the other things I saw is that some of them will go into a pond and lay down in the water around the shore even. I don't know, is that a cooling mechanism? Is that a way to get away from flies? Is it, I mean, I don't.
A lot of times they can be running a pretty good fever, so it might be cooling. It might be she went in for a drink and is too weak to, got out in the mud and was too weak to get herself back out. Because, you know, with that low oxygen comes weakness.
Yep. So anything else on clinical signs or things that people be looking for?
Of course, we have a heightened awareness of it if we've had one case, right, and that'll get us into thoughts about prevention, what we can do. But the reality is we have a lot of carrier cows that were exposed and were able to beat it, especially for the younger age. But there's what's called a cyclic parasitemia, where the number of cells that are infected, the red cells, comes up, and then the immune system mounts a response, it goes down, and then it comes up and it goes down. So a cow will do that maybe all her life.
I'll be. Huh. Well, we're going to take a break. When we come back, more on anaplasmosis with Dr. Mike Apley.
Every farmer knows that understanding the landscape is the most important ingredient for success. When it comes to investing in precious metals, United Patriot Coin can help steer you in the right direction. No obligation, just solid advice. Call now for your free guide, 844-202-7834.
Success in the cattle business hinges on a lot of different people playing their part. From the vet to the cowboy and the nutritionist to the feed truck driver, you rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to bimetabiologicals.com to learn more.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed Lidoband, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. Lidoband, a small device that can make a big difference.
Ranchers, looking to elevate your pasture management game? Turn to Heinen Brothers for expert aerial application. With state-of-the-art equipment and seasoned pilots, we deliver precision treatments right to your fields. From fertilizers to herbicides, Heinen Brothers has your pasture covered. Visit HeinenBrosAg.com to learn more.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson, and I'm here with Dr. Mike Apley, who is the Frick Professor of Clinical Sciences at the College of Veterinary Medicine at Kansas State University, where he is a full professor and he spends a lot of time working he's involved in research, he's involved in teaching, and he is involved in veterinary continuing education and producer education all around the world. And anaplasmosis is something that y'all have done quite a bit of work in. And so let's get into some of the, hey, can we prevent the infections and the clinical aspects of this disease?
So when you start talking about preventing infection, that's different than preventing disease. So to prevent infection, tick control, as much as we can, and sometimes that's a very high ask, right? Yep. But tick control, and then when we handle the animals, if you have your breeding stock, it's very common for people to change needles now in an anaplasmosis infected herd between animals, because we can, and the research has proven that we can put a needle into an animal that's a carrier and then use that needle on the next animal, and that can infect the next animal.
Yep.
So the needles, that's one of the ways we can minimize the chance of infection, but to say we can actually prevent it, we don't have any indication that any of our treatments would prevent infection in them. And again, if they're infected at a very young age, they look rough for a few days, their red cells come right back, and then they'll become an infected carrier capable of spreading it, but they typically won't become diseased because their immune system is constantly primed to react to it if they're exposed to a new isolate. And that's one of the things to understand about this disease is it isn't anaplasmosis. It's, I don't know how many different isolates, different, like people. We're both humans, but we're different. We're different isolates, right?
Right.
And these different isolates can come and go, and they've documented that within a herd, there can be multiple different isolates that are in the carriers, not just one.
Oh, shoot.
And so these can have different characteristics, including immunological characteristics. So, and then we can't really prevent infection. Can we prevent carriers? If they're infected, they're really going to become a carrier. So the next question is, could we clear carriers?
Yep.
Well, there's studies back in the 50s using some technology we still use today that would suggest we could at one time. And there's some reports today of being able to do it, and then there's a lot of where we failed, including in research. So that it tells us it's very isolate specific, and to try to clear them, we'd use chlorotetracycline. And there have been tetracycline resistance genes identified in some of these isolates. So it's very, very dependent on which isolate you have. And veterinarians are able to do diagnostic tests for if the animal is actually infected. They're able to do tests to give you an idea of what animals in your herd are infected. And then there's also the potential that they could send it in and have it typed for what kind, which isolate you have.
So they can do the diagnostics and they can say, hey, you've got the Mike strain or the Dan strain, and then probably, or I assume we're getting more information on how those stay or go, or how they can be treated.
Hopefully we will. I mean, there's a little bit out there on it, but to actually say this is this isolate. Now, there was one called the Singer strain, which is one of the original identified ones. And we know that the different isolates are very, very different in how aggressively they cause disease. Some could bring an animal down in a few days. Others might take a couple, 3 weeks because they're not as virulent or cause disease as readily.
Perfect. We're going to take a break. When we come back, we'll have a wrap up on anaplasmosis with Dr. Mike Apley. Hey folks, for your firearm and ammo needs, for gun safes and much, much more, and to have it personalized, come visit us at United Patriot Supply outside of Seneca, Kansas. You can also visit us online at unitedpatriotsupply.com. Be sure to say that Dr. Dan and DocTalk sent you, and we'll see you down the road.
Hey, I'm Clark Victory. I grew up right here on this little ranch near Chelsea, Oklahoma. Roped and ranched all my life. A few years ago, I had a injury that created what they call a frozen shoulder. And after speaking with the surgeon in Tulsa, he told me that he could make my shoulder better if he did surgery, but he absolutely couldn't fix it. And I called Kansas Regenerative Medical Center. I did the stem cell replacement. By 12:30, my wife and I had lunch and was driving back to Chelsea. We work around here. Some days we work pretty hard around here, and my right shoulder doesn't get sore. It's like a baby's arm.
The cost of an open cow these days is very expensive. It's hard at times to dedicate a half a day or a whole day to leave your practice to go palpate cows. And so Alertus test has helped speed the process up of getting preg rates back to the owners. And so free up time for diagnostics or working in your clinic. It also will help generate revenue, not being on site to do the testing.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson here with Dr. Mike Apley, and we're in Manhattan, Kansas, where Dr. Apley serves as the Frick Professor of Clinical Sciences. He's a veterinarian. He is a professor at the College of Veterinary Medicine at Kansas State University in the Department of Clinical Sciences. And I don't know if anybody's done more for beef cattle veterinary medicine in their career. He's a workhorse and a leader. And today, we're talking about something that you've done quite a bit of work on with anaplasmosis. And, you know, one of the questions we always get is, well, can't we just vaccinate for it?
Yeah, and diseases vary in how effective of a vaccine we have for them. And there is a vaccine available that you're able to use in a state if the veterinarian says, yeah, you can use that. It's a state licensed vaccine in another state. The data on it is thin if you try to look at a randomized study of vaccinated versus non-vaccinated, so I can't really speak in that nature of how effective it is. It's a tougher disease to have a good vaccine for. There's other vaccines that are under development, different ways of vaccinating for it. So there's some hope out there, but as of right now to say we've got one that's like for IBR or BVD that we just use, and everyone should talk with their veterinarian on what they've experienced in their area.
Well, I think too, as we get back to looking at vaccinating against bacteria versus vaccinating against viruses, and even the black leg is against the toxin, not the actual bacteria. So I think we understand that it's pretty tough to, you know, but then we've got antibiotics that don't do anything against the virus.
Right.
So,
well, and in this case, there's an antibiotic out there, and it revolves around the tetracyclines, and everyone should talk with their veterinarian about the correct application of those, whether it's in mineral or feed or injectable. But, you know, for treated animals, to treat one that's ill, it'd definitely be an injectable to get to those. Trying to prevent death loss in a herd by putting the drug in the mineral or in feed, I mean, it can help. And there's some herds that have had death loss one year and they start it and they include it the next year and they don't have any, but that's the nature of this disease also, is it's very cyclic. It can be cyclic within a year and it can be cyclic between years. But I think everyone would be familiar that, you know, you're not going to expect it in May, but as you get your vectors going and spreading the disease, then you roll on into August, September, October, then you start seeing the cases. And, you know, it may take them 30 to 60 days once exposed for it to get building and generating and reproducing and infect enough cells that the animal's infected. So we do have treatment options. And as always, one of the biggest things to do is have these animals diagnosed. If you have an animal with these signs, have a necropsy done. And then your veterinarian knows your herd, you know them, and they're the ones to talk to about options for treatment, prevention, control, you know, controlling vectors, switching needles, should you have chlorotetracycline in the mineral, and they can authorize that through a VFD. But they're, as always, when a disease problem like this, your local veterinarian's your lead-off person.
You know, you sit there and talk about, with the price of what these cattle are worth today, having that relationship with your local practitioner who's treating these cases in the region, knows the vaccines, knows the climate, knows the vectors, it's a no-brainer.
Yep.
So, thanks for being on the show today. It's good.
Thank you.
It's always good to have Dr. Mike Apley. Thanks for watching DocTalk. Remember, if you want to find out more about us, you can find us on the web at www.doctalktv.com. Always work with your local veterinarian. For Dr. Mike Apley, I'm Dr. Dan Thomson, and we'll see you down the road.
At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.